Hello and welcome to Patient Education and Health Promotion. Our objectives here today are to discuss the purposes of patient education, use patient teaching to promote the national goals of the Healthy People 2020 and Canada Health Act, describe 3 ways in which people learn and correlate the importance of these types of learning to teaching, and list and differentiate between conditions and factors that can affect learning. Clinical practice assesses and assigns patients' learning needs, develop a patient teaching plan based on the patient's learning needs, implement the teaching plan at a prearranged time, evaluate the effectiveness of the teaching and the plan. With the hospital stays being so short, patient education has become an even higher priority. A teaching moment occurs when the patient is at an optimal level of readiness to learn and apply a particular piece of information. Take cues from the patient's questions to try to stimulate interest in what he or she needs to know. What issues or problems could be prevented by effective patient teaching? Well, we could probably prevent medication errors, activity restrictions not being followed, things of that nature. If you can determine a patient's mode of learning and tailor your patient teaching to that mode, you will have better results. How can a nurse determine a patient's mode of learning? It is important to use a variety of teaching techniques so that a patient both sees and hears the information and performs the action being taught. Additionally, material being presented, like insulin self-injection is a good example, may dictate the method of patient education that will be best to use, although it should be reinforced with other models. The domains of learning also affect overall teaching effectiveness. If the teaching plan does not address the appropriate domain, affective, cognitive, or psychomotor, then the learning will not be optimal. What domains of learning might be involved in teaching a patient how to do a dressing change? Well, all 3 should be, depending on the patient and the magnitude of the process. Although most people can learn by any of these routes, one route is usually dominant. How can a nurse determine a patient's mode of learning? It's important to use a variety of teaching techniques so that the patient both sees and hears the information and performs the action being taught. The domains of learning also affect overall teaching effectiveness if the teaching plan does not address the appropriate domain. Affective, cognitive, or psychomotor, then the learning will not be optimal. So once again, what do we need to do? Which of those 3 modes of learning do we need to include in our patient teaching? Once again, it's going to be all 3. It is best to assess the patient's knowledge about his or her disease or illness before starting the teaching. Patients are sometimes embarrassed to tell the nurse that they do not know what is being said by the nurse. This happens even for patients with long-standing diagnosis. Everyone has assumed they understood their condition. Learning issues are perpetuated by the patient's fear of revealing their lack of understanding. Illiteracy is a problem that is frequently overlooked in patient teaching. It is usually recommended that patient teaching materials not be written beyond a 6th grade reading level. Patients who are tired in pain, anxious, or distracted with the environment are less likely to retain the information presented to them. Physical, occupational, or speech therapists can be helpful in assisting the individual to overcome these types of problems so teaching can begin. Memory, especially short-term memory, is often impaired in the elderly. This affects both teaching and information retention. Suggest different methods that will help elderly patients remember important information, such as medication dispenser with compartments for each day of the week to help remind them to take their pills as directed. What other methods can overcome memory impairments at home? Maybe writing out a schedule for a patient, which can be posted on the refrigerator at home. That oftentimes is helpful. The desire to return to independence or return to the comfort of home is often the motivating factor. Teaching sessions will be more successful if the patient is comfortable and rested, and there is a minimum of interruptions. The patient's cultural values and personal expectations regarding treatment and recovery may differ from those of the nurse and other healthcare providers. It is important to plan patient teaching that respects and demonstrates understanding of cultural and religious beliefs. If not, it is unlikely to be accepted by the patient. Play techniques can be very successful when teaching younger children. When teaching the elderly, the pace is slowed to allow more time for processing the information. Teaching patients to do a complicated multi-step procedure at home is best accomplished when it is broken down into smaller steps. Each time patients master a step, they gain confidence and proficiency. When teaching a patient, what is one thing you should never assume? Never assume that the patient is literate. What is a behavioral objective? Behavioral objectives represent the desired changes or additions to current behaviors and attitudes and should be meaningful for the patient. Consistency in teaching is important if the patient is to master and retain the new information. The internet has a wide variety of resources available for patient teaching. When teaching a procedure, talk about the steps of the procedure, demonstrate the procedure, and then talk patients through each step while they perform the procedure. The patient needs to receive written or printed information about what has been taught to take home. Why is it important to give the patient written information? Well, because it reinforces the patient education and provides reference materials for when the patient returns home. A return demonstration of a skill is one way of evaluating the learning that has occurred. Teaching often occurs informally while performing a nursing task, such as administering medications. This makes it a challenge to consistently document patient education. Patients may be discharged home before necessary learning is complete. A telephone call to the home health agency or to the physician's office helps provide continuity of teaching. So question number 1. As a nurse, Rachel knows that teaching a patient is done to assist the prevention of illness or promotion of wellness. All the following are true regarding a patient teaching except number 1, it is a process that begins within 48 hours of admission. 2, the patient must be taught how to care for himself at home before discharge. 3, nurses teach patients what they need to know about their disease or disorder, diet, medications, treatments, and self-care. Or 4, discharge planning requires looking ahead to what the patient will be facing when returning home. Well, the answer, of course, is number 1. It is a process that begins at the time of admission. With hospital stays being shortened, patient education has become an even higher priority that begins as soon as the patient enters the hospital. Question number 2. Madison is a student nurse who finds it easier to learn by performing a task. What type of learning is she? What type of learner is she? A visual, auditory, kinesthetic, or affective? The answer is going to be 3, kinesthetic. That's your hands-on learner who actually performs the task or handles items, and that's how they learn best. Visual learning is learning through what you see. Auditory is learning through what you hear. Affective learning occurs when the subject matter material is presented in a way that it appeals to a learner's beliefs, feelings, or values. Question number 3. Henry is a nurse working in a physician's office setting. If he is teaching a patient how to draw up insulin and watches the patient perform this task, he's teaching in which domain? It's number 1, cognitive, 2, affective, 3, effective, or 4, psychomotor. Answer will be 4. Psychomotor domain. The learner processes information by actually performing the task. In the cognitive domain, the learner takes in and processes information by listening to or reading the material. In affective, with an A, the material is presented in a way that appeals to the learner's beliefs. And there is no effective domain. Question number 4. Kara is working in a rural health department. She spends most of her day teaching patients and families. She realizes several factors affect learning. Which one of the following choices affects learning? Number 1, cultural values and expectations. 2, confidence and abilities. 3, readiness to learn. 4, environmental factors. Or 5, all of the above. Well, I'm sure all you guys know that it is answer number 5, all of the above. All of those factors affect the ability of learning. Question number 5, final question here. Holly is working in a geriatric setting. She understands when teaching the elderly she should, number 1, keep the TV on and turned up loud so the other patients can hear it. 2, use long sentences and speak rapidly to keep their attention. 3, use medical terms to describe all procedures and information. Or 4, review the information frequently and check for comprehension. The answer is number 4. When teaching the elderly, you need to keep distractions and noise to a minimum. Keep sentences short, and you want to speak slowly when teaching or giving information. If you use medical terms, you should keep them limited and explain them with an explanation that they will understand. It is essential that you review frequently and check for comprehension.